medicines in our space hadn't changed over 100 years. So when you see a tool like telehealth introduced into the community, it's a game changer. Now, there's a lot of hype and discussion around AI and what's its fit. I don't believe we're at a place right now where AI can replace physicians and therapists. What I believe AI can augment a doctor's office or a practice is in streamlining the things that take a lot of time, particularly for those organizations that don't take insurance or need to take insurance. AI is a game changer because it never sleeps, it doesn't call in and so forth. And you, in essence, program it to do the things that you need done, those repetitive tasks. And so dictating notes, making sure that what we say in this visit is charted the appropriate way so that individuals can get the maximum amount of reimbursement, which is an issue in our space. So what I see in the next 60 months, the next 5 years, AI is just going to be heavily integrated into our space to help clinicians deal with the sheer volume. And when I say sheer volume, we're seeing unprecedented levels of anxiety. People are self-isolating. They're dealing with chronic stress, primarily dealing with money, and they're having proper consumption. And when you have those three things together, anxiety goes through the roof, and there are not enough people to deal with that as it states. So AI is going to allow people to give their very best to more people. So I see it as a game changer.